All right. Hi, this is our presentation for In the Light of Evolution project, and our topic that we chose is RSV in infants.
So what is RSV? RSV is called respiratory syncytial virus. It is a virus which causes respiratory infections in infants and the elderly, and it resembles a mild infection like the cold. And it can be very serious for the elderly and infant population in the US, causing the most hospitalizations. So some stats about RSV. It kills around 200,000 pediatric deaths annually, with 101,000 of those being age 5 and under. Some high-risk populations include premature infants, immunocompromised infants, and infants from either American Indian or Alaska Native descent. Some treatment statistics include that 83% of those that receive vaccines are not hospitalized, and mothers that receive vaccines have been reduced transmission rate of 82%.
So some risks of RSV, some mechanisms of RSV and how RSV is transmitted. So the main mechanism of RSV is that there's a G protein that interacts with the cell surface receptor, and this kind of determines which of the cells are going to be infected by the virus. So learning the mechanism of the virus is very crucial to understanding how the virus works and for developing antiviral treatments such as vaccinations. RSV is very difficult to avoid as a virus because it's really easily transmitted, especially through coughing, sneezing, or coming into contact with infected surfaces from bodily fluids such as spit or snot. RSV can also infect any infant, and roughly 80% of hospital admissions of infants come from healthy babies who only have RSV. And previously, doctors and pediatrics mainly relied on therapies such as providing external oxygen in order to just address the symptoms of RSV, but there was no preventative measure to kind of counteract the virus and help build your immunity before you become sick. But during the course of the past few years, there have been some research done to reduce RSV illness and to help lower the mortality rate when it comes to RSV deaths.
The relevance of developing RSV vaccines in an evolution explanation. So vaccines are just a form of the virus that are weakened and elicit an immune response. And usually this is done to help produce antibodies. In the past, those infected with RSV were given Synagis, a drug which is a dose of multiclonal antibodies, and this reduces the severity of the response in those that were at high risk. Although this offers some protection of the body, the people that were given these antibodies weren't able to produce them themselves, so it limits the immune system's ability to fight against infection if they were to be infected again. Thus, vaccines are being used to continually target the receptor proteins that target the entry of the cell. In general, this will likely lead to new mechanisms of entry for the virus and could likely lead to an evolutionary arms race in terms of immune response, how we combat it, or development of new vaccines or targets that render the virus incapable. Due to the large increase in hospital admissions in the winter, it is common for children's health services to face severe pressure at times. As a result, many UK health workers hope that implementation of a vaccine for RSV helps to lower the rate of hospital admission in infants and reduce pressure on hospital services.